First, live, local. This is Fox 12 Now.
Hello, everyone. Welcome back to Fox 12 Now. I'm Greg Nibbler, as always. I always say this, and I do mean it. I appreciate you joining us. Whatever platform you are watching on, we get to talk about a lot of different things here on this show. We cover a lot of different breaking news and segments, but something that I think could be affecting a lot of you out there is what's right there on your screen. Seasonal affective disorder. Once the weather starts changing a bit, once the light stops being as much as it used to be, because obviously we're heading into December, it can definitely have effects on you. And I know it does for me personally. And so that's why I wanted to have a segment about this, just to talk about it and actually talk to an expert about maybe some different ways that we can mitigate some of those issues. And that's why I'm very pleased to have joining us right now, Dr. Ruth Suniga, who is going to be here to talk about all of this and more. And there you are. Doctor, thank you very much for joining us here today. Really appreciate it.
It's a pleasure. Thank you so much for the invitation. And it's so wonderful, Greg, that you are willing and have this desire and motivation to talk about this topic, because as you said, this is a conversation that needs to be happening, that affects a lot of people. When we think about seasonal affective disorder, a lot of times people tend to normalize it and say and think that seasonal affective disorder is just winter blues, or there is this just feeling sad, but seasonal affective disorder is more than that. And therefore, having this conversation today about it, hopefully it will help first start the conversation, remove some of the myths about this mental health condition. And the other thing, hopefully we can give some high-level points of things that we can do to help us if we are experiencing some difficulties during this winter season.
I love that. Thank you very much for being here to have that conversation. I think, to start off, could you actually give what the actual definition of this is, of seasonal affective disorder, and what some of the key components are that could cause this to occur?
So as I said, a lot of times people confuse seasonal affective disorder with the winter blues. But when we think about this disorder, one thing that is important to recognize is that it is a mental health condition. It is not that an individual is not trying hard. It's not something that may go or come quickly. It affects individuals in different ways, but very, very important, it is more than sadness. It is more than feeling down. And what are some of the things that we can look or that can tell us that maybe this is a situation that somebody is experiencing? One of the things that is the symptoms, looking about the symptoms, similar than other kinds of mood disorders, or what people sometimes call depression. We may see individuals experiencing loss of interest in pleasurable activities, things that they used to enjoy in the past, they don't enjoy as much. People may become more isolated. They have a tendency maybe to increase, they may have a tendency to increase in their sensitivity to rejection. So a little bit more, feel more vulnerable, more raw, their emotions in relationship with talking with other people or spending time with other people. We may see also irritability, anxiety, guilt, hopelessness, fatigue, low energy. But a couple of things that are specific about seasonal affective disorder is that sometimes during this time, individuals may have an increase in appetite, specifically desire to eat sweets or carbohydrates. I don't know if that happens to you. To me, Greg, during this time of the year, I want to eat a lot of ice cream. I don't know if that's the case to you.
Pizza. Yeah, I would go with that.
Pizza, carbohydrates, pizza,
Yep.
pasta. And that tends to put an individual into a risk of increasing weight. And also we may see people feeling more lethargic, having more sleeplessness, feeling like that desire to sleep more. And we also see individuals experiencing, unfortunately, thoughts of or death of suicide. What is also different about this condition is when it starts and who are at more risk. Individuals who are at more risk are people who live in farther from the equator. Like I'm from Costa Rica, I'm from the center of the world, the very close to the equator, and then, coming here to Oregon, living farther from the equator, we may see those individuals experiencing more difficulties the farther we are from the equator. And it has to do with the lack of light or the increase of light. Sometimes people may think that seasonal affective disorder is only affects individuals during the winter. And yes, the majority of the individuals get affected by this condition during the winter, but there is also one that is called summer depression, that people call it, which is for individuals who experience similar symptoms during the summer. So very important to recognize when it starts and when it ends.
So it's a very individual thing. You mentioned, just to kind of recap that. So majority is with the less light, but some people, it can be the other way around.
Yeah, and it has to do with that shorter or increasing for those other group of individuals. But for the most part, for people who have experience or we live in areas where there is a shorter in the days of less lights during the day, that increase or trigger certain chemical changes in our brain. And so this is the reason why I mentioned, say, it's important to recognize that it's not only being sad or unhappy, or that this is just something that we don't have to take serious because it's just winter blues.
And that is important, because sometimes it is easy, maybe make light of it. But you mentioned winter blues, but this is something that's that's important to recognize. And you went through what some of those symptoms are, which I think is really good to understand what those are. And so if somebody is experiencing those symptoms, how do you know whether it's actually this or just something else that's happening in their life?
Very important is, when do you experience these symptoms? One of the things with this condition is that sometimes there are patterns. Maybe this is not the first time that you experience it, but you have noticed that during the fall, you start noticing the symptoms, and maybe they disappear during the spring. So recognizing and paying attention when the symptoms start and when the symptoms are just, they leave. But also recognizing that aspect of what is happening in your body in regards to the sleeplessness or being fatigued, also your motor retardation, if you feel having more difficulties about moving, or feel like your body is not like you're within yourself, or you're not within your body, or you may actually feel a little bit agitated too. But very important is the seasons is one thing, but the other thing is, if you're uncertain, don't wait. Any mental health condition, or every time that you feel overwhelmed, that you feel like you're not yourself, don't doubt and seek out help, because this condition has to be some mental health condition. It's not just a simple thing that comes and goes. Affects individuals to a level that can affect significantly their functioning. Their functioning, meaning how they relate to their loved ones, how do they engage in their work, how productive they are to society, how much they can participate within their communities. So if you notice that you have these symptoms, and these symptoms feel overwhelming to you, distressing, and also see that you're functioning as a human being as a productive human being in society, and your role, whatever your role is, as a parent, for example, you're not being able to accomplish your role as a parent, for example, or not able to attend to your schooling or to your vocation, please seek out help.
And I think that's very important to let people know that, to seek out help. And I think that's kind of leads us right into the next thing, is what kind of avenues are there to seek out help? Like what would the best avenue be for seeking help for this?
Yeah, very important to talk with your primary care provider, because one of the important things to seek out help is to get an appropriate diagnosis, because maybe it's seasonal affective disorder, maybe it's something else. And it is a medical provider or a mental health professional who can help with that diagnosis. And that diagnosis, the appropriate diagnosis, is going to lead you to the appropriate treatment. So your primary care provider, general provider, is a good resource There are numbers like 211 that an individual calls to say, where can I go and seek out or get support from a mental health provider if you want to go into that direction. The wonderful thing about Oregon is that we can go and seek out help directly to a mental health provider without a referral from a primary care provider, but a primary care provider can help as well. And there is one number that maybe many in the community know, but it's important to share, is the 988 number, 988. And it's an easy number to remember, to recall. And the 988 number is a number that is focused for crisis intervention and suicide prevention. But a lot of times people think that it's a number only for suicidality or only for those individuals who are contemplating or thinking about suicide. But 988 is also for individuals who may be feeling in crisis. Or it's another thing about this number is it's a number that we can also call if we don't know where to go, how to do something, or if we want to help someone and we don't know where to seek out resources for that individual. So it's a number for loved ones as well.
That's great to know those different numbers and those avenues to call if that's where you're at. Are there other things that people can do during this time of the year with the less light to, just help out with the physical side of the moods?
Yes, definitely. There are, even when this condition is known as, it's difficult to decipherate or to understand what we can do to prevent it. There are things that can help us to improve it, or there are things that can help us just to regulate our own emotional health. One of the things is very important is the exposure to sunlight. And always that I say this, people say like, we are in Oregon, where is the exposure of sunlight? And I say exposure to sunlight. I don't say exposure to the open sunshine right there. So that means, how do you get exposure to sunlight? For example, for you, Greg, how do you get exposure to sunlight if you needed to do something like that?
It's difficult. That's a problem that I have. Other than taking a trip to California, it's
Yeah,
hard,
so on that way. But sometimes, if I will move my computer here, you will see that I have a window there. So sitting close to the window. Oh, sorry, there you go. There is my window right there. So trying to sit close to a window, if it's possible, even if it means arranging your work area. Spending time outside in nature is important. And even if the light, even if it's not direct sunlight, but that exposure, especially the sunlight in the morning, even if it's very, very subtle, just a walk in the morning can be helpful. And people say, why in the morning? It's because it helps with this circadian rhythm too. And it helps you just to start your morning. I know and I understand how hard it is to walk outside, especially during raining days, but it's one of those things that can be very helpful to us. But exposure to sunlight, as I say, in different ways, even if it is just sitting by a window and having that the light coming through the window. Maybe cleaning if you have around your home, maybe plants that obstruct the light or curtains that obstruct the light from your window, remove that. Other things that may help is light therapy. You may have heard that there is light boxes that individuals can use. Those tend to be very effective, but not every light works. So there has to be certain locks involving that light, and that's when talking with a provider about what is the best light for you is important. And also when light therapy you have to also choose when you're gonna use it, so it doesn't affect your normal sleeping pattern and your normal sleeping routine. For some people, maybe it's necessary that they take antidepressants or other kind of medication. Psychotherapy is another thing that can help as well. And for some individuals, maybe taking supplements such as vitamin D. But again, those things is important that you talk with your medical provider about it. However, changes and positive activities of lifestyle changes, things such as eating healthy, eating what our mothers and grandmothers will tell us to eat, Yes, that is very important. That means I know I don't think my grandmother will tell me to eat a lot of ice cream or for you, Greg, to eat a lot of pizza, but what they will encourage movement, body movement, and I say movement more than exercise. Of course, if you can exercise 30 minutes a day, every day, that's fantastic. But if that is difficult to you, start with 5 minutes. 5 minutes is better than nothing. Another thing that is very, very important is find ways to connect with other people, people who you can trust, to connect with people who can give you joy or bring joy into your life, or connect with other beings. Maybe it's a pet, maybe it's nature, maybe it's a higher power, but finding moments to connect. Another thing is keep your routines as close as possible because that helps your brain to reset in moments of distress. And as I say before, nature, spending time in nature, very important, and staying away from alcohol and drugs, as especially as alcohol can worsen or can make the symptoms of depression worse. And two more things, as I said before, seek out treatment, seek out mental health support. But one thing that is also very important is that every day, find even one moment of your day to find joy, to do things that you enjoy to do, even if it is for one moment. And my patient sometimes says, Dr. Suniga, but how can I do that when I don't feel like I can find joy in those things anymore? And I always say, try it, because that's how you're gonna start again feeling joy if you just start trying, even if it feels empty for a moment. And that's the reason why connecting with other people and asking other people to support to find those moments of joy. And those moments of joy can be something as simple as enjoying a piece of chocolate. It can be as I'm gonna take this shower and I'm gonna take it with the right temperature so I can enjoy that moment. It may be looking through the window and seeing if how nature around you looks like. Or it can just be holding the hand of your kid or holding the hand of a loved one to just feel that connection and to enjoy that moment together.
Wow, that's a lot of really valuable information that you have just shared with us there. I think my final question would be, what do you think is the one thing that you feel that everybody should know about seasonal affective disorder?
One thing, very, very important thing is seasonal affective disorder is a condition, a medical or a mental health condition. It is not, again, I want to say it's not winter blues. And therefore, it is important that if an individual is experiencing it or experiences some of the symptoms that I mentioned before, to seek out help. Get help because you may be experiencing something that may be more than depression, and a healthcare provider can help you.
Well, Doctor, thank you very much for joining us today and talking through this and explaining it out, because I certainly learned a lot just from what you've been explaining to us, and different ways to help recognize things and help to change things, and is very, very helpful. So I thank you very much for joining us.
My pleasure. And thank you so much for talking about this topic. And thank you to the audience for listening today.
Absolutely. Doctor, thank you so much. Have a great day.
You too. Bye-bye.
So very valuable information right there. I will tell you that I definitely learned a lot. So this is one of those interviews where if you want to, you can share this with other people. So you can go to our YouTube channel, just click the live button there for Fox 12 Oregon. You can go to our Facebook page. You can also go to our website, or our apps is another great way to watch these segments and share them. We have them for every kind of device that you've got. We've got an app for that. So just look for the Fox 12 Oregon app and share this, let other people know about it, because it's an important topic to cover. We cover a lot of things here on Fox 12 Now, whether that's breaking news, whether it was weather earlier, and then talking about this. We do have more coming up. I am going to be hopping off here for a little bit, but coming up here just for Fox 12 Now, it'll either be today or tomorrow, but we've got an interview with My Voice Music, talking about what they're doing. We're going to be talking to Travel Oregon. We're going to be talking to Radio City, the Rockettes. Actually, there's two Rockettes from Oregon that we're going to be covering. We're going to be talking to them. all kinds of things happening this week. So, and all that plus, like I said, breaking news and everything else that we're going to be having here. So thank you for joining us. Thanks for being a part of Fox 12 Now. I appreciate it. I will log off for now. If there's breaking news, you'll see me back here. Otherwise, of course, at 4 p.m., we have our regular newscasts, and you can always follow along at kptv.com for all the latest information on any of the breaking news stories that we're talking about. So thanks for joining us. I'm Greg Nibbler. This is Fox 12 Now.